This is a quick overview on the Insight 100 of some common mistakes that happen while trying to image a patient. Not all of your patients may be cooperative, or maybe you've been a while since you've used the instrument. So we want to demonstrate to you some of the common error codes and how to resolve them. Some of those error codes may be the patient's blinking while you're trying to image. Some of the error codes might be the patient is well off-centered, where their iris is not centered in the diamond on the operating. It could be that your patient has quite a bit of mascara floating around. It could also be that there's bubbles. If their eyelashes are oily as they enter the instrument and the saline is filled, sometimes bubbles will remain on the eyelashes. Here you can see one very clearly, and ultrasound does not react well to air bubbles. So in that case, we would ask the patient to blink a number of times, just blink, 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 trying to knock those bubbles off. If those bubbles don't want to clear, you've already filled that eye seal. That's mistake number one. The first thing to do at this point, you can't recover. So the idea is to now have the patient try to come back. Although we're getting a bit of an image here, you've initiated it, it's well off center, and the images could be much better than what we're capturing here. So if you throw an error code on the instrument, if something happens during the scan, so let's say that patient's blinking like crazy, fluid levels dropping low, or any of the such, and you've gone ahead and initiated a scan, and then an error, the instrument is not able to even center on this patient. They won't stop blinking. You're coaching, nothing can be done. You want to stop, you're frustrated. Well, guess what? The instrument is going to go ahead and not be able to get this at all. And so it's going to tell you, here's an error during scanning. It's just not able to get. And look at the image. You're frustrated. So really the issue here, you have a very low fluid level on this. The patient's got blinks like crazy. You've got bubbles on the eyelashes. So the only thing you can do at this point is drain the eye seal, let the fluid out, take a deep breath, and get ready to coach the patient through. Always, I understand that you want to have patients moving through the clinic quickly, a lot of pressure on you to have the patient workflow be uninterrupted. However, it is altogether more important to get a good quality image, and with a little practice, you should be able to get an easy image first every time. So what you want to do as an operator, before the patient the eye seal is filled back up again, Nancy, I would have you double click on the image before he even leans in. Back away from the instrument, please, patient. Now, click in the center of the diamond, right in the center of there you go. Click there, double click. Now you've recentered the diamond. Now you can have the patient approach. This kind of puts you right back at the beginning. You want to make sure that your chin rest is high enough. The patient's gaze is straight through the center. If you're having difficulty seeing that, you can change the camera brightness if you wish to brighten the camera up a little bit. We have a fairly bright room. It's hard for us to see that here. We're noticing that the off center, off center, off center. So see how Nancy has gone ahead and clicked and brought the pupil back toward the center of the box. Take your time in aligning the patient at this point so that you're assured that the probe will be able to register on the iris, refill the eye seal. Tell the patient you can blink a few times, you can have your eyes closed at this point. Nothing is going to touch the patient's eye. There's no reason to be worried. It's a very quick scan. We can double check back, one more click on the pupil, and tell the patient look straight forward, and initiate your scan. I can still see bubbles on this patient's eyelashes. I can see their eyelashes, upper lid lashes are pushing down through. However, we're still fairly centered. We ought to be able to get a good image on this. It's a simple bicanthal plane. Let the instrument center, wide open, and there we have a good image right away. So just taking a few moments while the eye seal is dry and centering the patient on the eye seal will help you get a good image quick right away. We hope this was educational. Again, give us a call if you have any questions. We're here to help you. Thank you.